Good evening, guys. No, I'm Dr. Prasanna. Today, I am going to discuss the second topic in fetal infections, that is Group B streptococcal infections. Okay, we know the Group B streptococcal infections, right? Like the mother, if she's having that disease or if she's a carrier, then the fetus will be getting. So main problem is in case of chicken pox, both mother have a risk and even baby have a risk, right? But in case of GBS, mother is something like okay, but baby will have greater risk. Baby can land up in ventilation, even death. Okay, so main thing in GBS is to protect the baby. Main thing in GBS is to protect the baby. So first, initially we'll discuss about Group B streptococcal infection, where the incidence of Group B streptococcal infection in UK is 0.5 in 1,000. In 1,000 pregnancies, only 0.5 pregnancies will get affected. That's about incidence. Okay. So this Group B streptococcal bacteria is there, that is present in the intestine of every individual. Most of the individuals it is present. If it is present in that individual, that is known as colonization, and that particular individual is known as carrier. Okay. If this kind of mother, if this kind of lady becomes mother, then she is a GBS carrier. So do we do screening for every mother, like how we do hemoglobin, how we do blood grouping for every mother, no? In case of antenatal? Do we do that bacteriological screening for every mother? Means no. No, we should. It is not universal screening is not recommended in case of GPS. Okay, so what should we do? If at all any UTI if she's facing and it was been came positive as DBS, incidentally we found out that she's a GPS carrier. Okay, then you can continue the medications. Generally, the universal screening is not recommended. Okay, so if you want to perform GBS screening, then generally we can perform 35 to 37 weeks. How much? 35 to 37 weeks, or else 3 to 5 weeks before expected date of delivery. Okay, so in case of the twins, we'll perform that in 32 to 34 weeks. Okay, so let's discuss it in detail. Okay. So I hope you can see my white screen, right? Right. So, so it is Group B streptococcal infection. Group B streptococcal infection, right? Hmm. So Group B streptococcal infection. Uh, we'll see the incidence. What I told is it is 0.5 in 1,000. It is 0.5 in 1,000, right? And basically, the fetus, the mother is okay, and fetus, we are mainly concentrating on fetus. We are mainly concentrating on fetus. If it is occurring within 7 days, within 7 days of delivery or baby, that is known as early onset GBS. That is known as early onset GBS. Okay, right? Now, which I told that antenatal screening is generally not recommended in every pregnancy. We don't do the antenatal routine screening. Okay. So, coming to what kind of basically, see, this is a uterus. So, this is the fetus, right? So, fetus once pass through the vaginal canal, then the fetus get affected by means of GBS. So, basically, vaginal delivery have high risk that baby can get GBS. So if cesarean has a risk, no, cesarean has no risk. But if it is emergency cesarean section where mother already been into a labor, then in case of emergency cesarean section, she has a risk. Okay. If IUD, if IUD baby had been delivered by vaginal delivery, does it has any sense of giving any antibiotic prophylaxis to the mother? No, because already the fetus been died. Okay. We are giving antibiotic prophylaxis to the mother to protect the fetus. That's what. Okay. So what is this antibiotic prophylaxis? Okay. Intrapartum antibiotic prophylaxis. Intrapartum antibiotic prophylaxis. What is that? This means, see, that has a definition that, see, antibiotic prophylaxis is generally will give benzyl penicillin. What is that? Benzyl penicillin. Benzyl penicillin will give. What is the dose of benzyl penicillin? We'll give about 3 gram IV. We'll give 3 gram IV. Okay, we'll give 3 gram IV. So 3 gram IV. So sorry for that. So 3 gram IV will give, followed by the maintenance dose. Dose generally will give 0.5 gram IV every 4 hourly. Every 4 hourly. Okay. So that is in that dose of benzyl penicillin, which is being given as 3 grams and then followed by 0.5, 1.5 grams 4 hourly, 3 grams IV, followed by 1.5 gram 4 hourly. This is the IAP prophylaxis. Okay. So this dose which we are giving in case of to protect the baby, that is known as intrapartum antibiotic prophylaxis. Okay. If the mother is allergic to penicillin, then we can't give penicillin. So we'll see what kind of allergy it is, mild allergy or it is severe allergy. If it is mild allergy, if the mother is having mild allergy to penicillin, then we can go for cephalosporins. If it is very severe allergy to penicillin, then we will go for vancomycin. So see, IAP is, I told that we'll give 4 hourly till delivery. So for example, one mother came and she didn't deliver till 2 days. Then you'll give for till 24 up to 48 hours. That means generally they'll say that minimum we should give IAP for at least 4 hours. For at least 4 hours we need to give. Okay. But they say that generally we'll deliver. We won't keep baby for 2 days. Okay. We should do delivery. At least go for if it is non-progress, then go for cesarean section. Okay. That's it, and that is IAP prophylaxis. Now I tell, if the mother declines IAP, if the mother says I don't want the IAP, I don't want to take IAP, then what to do? Then nothing, like don't just force the mother to take IAP. We'll say that, see, fetus has risk. So after birth, after the baby is born, then we'll monitor the fetus. We monitor the fetus. How we will monitor fetus? We'll monitor the fetus at the time of birth. We'll monitor the fetus at the time of birth. Then at the time of birth, then 1 hour, then 2 hour, then every 2 hour week for 12 hours. Okay. But then every 2 hour week until 12 hours. Okay. Until 12 hours of birth. Until 12 hours of birth. You understood? Like for the baby was born at 1 o'clock. Okay. 1 o'clock it was born. Then you'll monitor at 1 o'clock, then 2 o'clock, then then uh, then 2 o'clock you'll monitor, that is 1 hour. Then you'll go from 1 o'clock. Okay. From 1 o'clock it is 2 o'clock. Then it is 4 o'clock. Then every 2 hour, like 6, okay, 8, in that way, every 2 hour until 12 hours. Until it is 12 o'clock, we'll monitor the baby. What you will monitor? Because baby can land in seizures, can have respiratory dysfunction. So we'll monitor that in baby. Okay. If it is like that, then we'll give antibiotic prophylaxis to the baby. So what is antibiotic prophylaxis to the baby you'll give? That is pen and gel. What is pen and gel? Pen is penicillin, gel is gentamicin. You will give that in case of baby. Can we give breastfeeding to the baby? Yes, we can give breastfeeding to the baby. That is not at all contraindicated. Okay. Now we'll learn about what are the different. First, I'll tell initially, then we'll discuss in detail. Okay. So, for example, a lady came. A lady came, and she was posted. She was posted for elective cesarean section. She was posted for elective cesarean section. Question is, do we need to give IAP or not? Do we need to give intrapartum antibiotic prophylaxis? Then, as it is a elective cesarean section, there is no need of giving IAP. If it is emergency, then you'll give IAP. Then you'll give IAP. Okay? If it is emergency, then you'll give IAP. That is one scenario. Second scenario, if a lady came and this lady has a GPS bacteriuria, she had a UTI and we tested that, and it was showing that she had a GPS bacteriuria. Okay. If she's having bacteriuria, then you'll give both oral antibiotics you'll give, right? Oral antibiotics will be given, and also intrapartum antibiotic prophylaxis will be given. Okay, that is second scenario. Coming to third scenario, pregnant lady came, and she's planned for vaginal delivery. She planned for vaginal delivery. So for this lady, and we will see whether it is term or not. What is term? 37 completed weeks. So 37 completed weeks lady came, and she was planned for vaginal delivery. Then you will see any risk factors are there or not. Any risk factors are there or not. If there is no risk factor, then there is no need of giving any IAP. If there is no risk factor, then there is no need of giving any IAP. Okay. If she's having fever, if she's having fever, temperatures of 38 degrees, temperature of 38 degrees, then you'll give broad spectrum antibiotics. Then you'll give broad spectrum antibiotic. This broad spectrum antibiotic should cover GBS as well. This broad spectrum antibiotic will cover GBS as well. Okay. If this lady if this particular lady, who is a term pregnancy, have GBS carriage, if she's a GBS carrier, if she obviously if she's a GBS carrier, then you'll give IAP. Okay. So three conditions in case of term, that is, if she's having no risk factors, then no IAP. If she's having fever, then you'll give broad spectrum antibiotics. If she's a carrier of GBS, then you'll give IAP. Okay, intrapartum antibiotic prophylaxis. Now, this particular lady who's a term pregnancy, she came with rupture of membrane. That is pre-labor rupture of membrane. Okay, pre-labor rupture of membrane. She came with that. And she is a known case of, she's a carrier. Basically, she's a carrier. If she's a carrier, what you'll do? Generally, if there is rupture of membrane, what you'll do? If there is a rupture of membrane, generally we'll go for, we'll wait for spontaneous delivery. We'll think, okay, let it wait, it will progress and we'll wait for spontaneous labor. But in case of GPS carrier, and she had a rupture of membrane, she should not wait because the GBS bacteria will transfer to the fetus easily. So for those people, we'll go for immediate intrapartum antibiotic IAP, intrapartum antibiotic prophylaxis, and immediate induction of labor and deliver the baby. Immediately will deliver the baby. Okay, this is the thing. So always remember, if she had a rupture of membrane, then immediately you go for induction of labor. Okay. Moreover, mainly in case of GBS carriage, that is a very important risk factor for carriage. Okay. Uh, coming to coming to the next point, if she's unknown, if the lady is like she's saying that I have a this thing, I'm a GPS a rupture of membrane. I'm a term pregnancy and I have a rupture of membrane. Okay, I have a rupture of membrane. Then in case of term pregnancy and rupture of membrane, then you'll go for you'll see whether she's having GPS carriage or not. If she's a GPS carriage, then you'll go for IAP. If she says that I don't know, it's unknown or it's negative for GPS, then no end of any IAP. Okay. Next condition is if a GBS carriage patient, she says that, see, this is my second pregnancy. In my first pregnancy also I was carrier. So then you will say that, okay, listen, but you have a 50% chance that you can have, the baby can get affected and 50% chance that the baby can't be affected. Okay. So you explain that to the patient and you'll go for screening. If she's not in labor, you'll go for screening at least 3 to 5 weeks before delivery. So 3 to 5 weeks before delivery, you'll go for screening and you will say that, okay, you had a GBS carriage and before also you had a carrier, then you'll offer IUD. Okay. If she's preterm labor, you'll obviously offer IAP. Preterm labor, you should offer IAP. If the previous baby, she said that previous my child also been affected, like we spent a lot of money in case of my first child also, then in this pregnancy you should offer IAP. Some people says that if there is rupture of membrane for more than 18 hours, then also you should offer IAP. Okay. Now once we'll see the algorithm and so that we'll have a good thing. Okay. I hope you can see the screen. Yes. So I told her a pregnant one came, okay, right? Um, a pregnant one, she's saying that she's having elective cesarean section, regardless of her GBS carriage, even though she is GBS carriage positive, then also there is no need of IAP. Basic concept is baby is not coming through the vaginal canal. Okay, so that is first step. Second is If GBS bacteria is present in this pregnancy, then you'll offer the antibiotics and also offer IAP. Okay. Third thing is if she planned for vaginal delivery, then you'll see term pregnancy or not. If she's in term pregnancy, then you'll go for then you'll see whether she's in labor or not. If there is no risk factors, then no IAP. If there is any fever, then you'll offer the broad spectrum antibiotics. Then you'll offer the broad spectrum antibiotics, which also cover the GBS. If she's carrier, if she's already carrier and she's in labor with term pregnancy, then you'll offer IAP. Okay, that's about third point. Okay, coming to fourth point, if she's planned for vaginal delivery and she's a GBS carrier, then then I already told that she is a GBS carrier in previous pregnancy. Then if she came in 28 weeks or 32 weeks, then you'll test the carrier status at 3 to 5 weeks before expected date of delivery, and you'll offer the IUP. Okay. If she's in labor, you'll offer IAP. If she's came like normal for antenatal checkup and she's saying that in my previous pregnancy I was a GBS carrier, then you'll offer bacteriological testing at 3 to 5 weeks prior to delivery. Okay, and this is fourth point. Fifth point is if she's in preterm labor, then you'll offer IAP. These two are offer IAPs. And if the previous infant been got GBS disease and she spent a lot of money, then also you'll offer IAP. So just to have a glimpse, if previous baby has been affected, offer IAP. Which is in preterm labor, irrespective of the carrier status, will offer IAP. Okay, and if she's a GBS carriage in previous pregnancy, you'll offer IAP. If there is a GBS carriage in current pregnancy, if she's a GBS carriage in current pregnancy, also you'll offer IAP. Mm, so this is the thing. So this is the thing of GBS. No very important questions in case of GBS is the incidence, which is 0.5 in thousand, and IAP is benzyl penicillin, that is 3 grams IV stat dose, and followed by 1.5 gram IV 4 hourly until delivery. That is one more important question. And the offer IAPs in which conditions, all the conditions, which scenarios we discussed. These are important questions in GBS. Okay. Next, we'll discuss about herpes. Okay. Thank you.